So I was going to tape this from the first day that I had my eyes done, but I didn't really get around to it. So this is actually day 3. I will actually post pictures somehow and place them on a video of this process that I'm in. So this is day 3. So I will go super close. I had my lower and upper eyelids done, as you can see. This eye is coming along much better, and it did right from the beginning. I don't believe that she pulled a lot of fat pads. So the reason why I decided to have this surgery was because I was getting those little fat pads. I don't know if anybody knows what I'm talking about. Some of my girlfriends didn't see it, but I did. And it was very bothersome. It looked like you woke up and you had puffy eyes, but the puffy eyes never went away. Almost like an allergy of some sort, you know, to grass or mold or whatever it is. So also I had it right here too in the corner of my eye. So I had that, and then I don't know if you've ever seen anybody with the corner of the eye and it starts hanging and it's loopy. So I wanted to do something with it, you know, right away so it wouldn't look so horrible, and it will make my eyes look brighter, and actually it will take a lot of years off my poor aging eyes, as you could see. So this is my right eye, and it's doing better. The first day is not that bad. It's the second day that gets a little aggravating because you really can't use your eyes that much. You'll get really tired. You can't watch a lot of television. So I just had a bowl of ice with cold water, and I had these compresses that I was just putting on them real lightly, along with doing what's it called? It's not Neosporin. Let's see, it's let me get my bag for you. It's bacitracin. It's zinc ointment. And I put that all over my eyeballs to make sure that, like, all the stitches, but you really can't see the stitches underneath, a little bit, you know, but none of them are stitches that have to be pulled out. So none of these will have to be taken out. They'll just dissolve. So this is day 3. So, and now this is my other eye. It just bruised a lot more because I had a heavy, heavy, heavy fat pad right over here. It kind of looked like a huge one from here all the way to here. And then sometimes it was puffy. Even if I put like medicine, you know, like cosmetics on it, you know how they say, oh, you put it on your eyes and it'll reduce the swelling. Nothing was really working. And again, it was in the corner here, and that will actually all become better. It's a little lumpy right now, but this is day 3. So there's not a lot of pain. I actually had it when I was wide awake. So all she did was shoot lidocaine into my eyes or surrounding area, so I was numbed. She normally doesn't take away all these fat pads when you're awake, but I'm a pretty good candidate and I can take pain, and it doesn't bother me that she's, you know, doing whatever she's doing, especially when she's cauterizing it. That's like that, you know, like a fly hitting one of those electrical shockers to kill them. It's kind of like that when you cauterize something, so it just stops the bleeding. I didn't have much bleeding, which is good, but again, I had a lot of fat deposit here that needed to be taken out, so I think that's what happened. There was a lot of trauma to this eye. When you had these fat pads, which she was telling me, which was very interesting, she's super awesome. Her name is Dr. McLean. I would highly suggest you going to her. She's downtown Chicago, 680 Lakeshore Drive. She said that she has to get through, so there's the epidermis, then there's the dermis, then there's the fat, and then there's this thing called, I don't know, it begins with an S, maybe septum or something like that. And then there's the fat pad. So she has to get through all that tissue in order to, like, kind of squeeze that fat out of the out of my body, actually, almost like squeezing. I was like telling her, I was like, it's almost like squeezing a pimple. I know I look really horrible. I mean, I usually look a lot better than this, but I thought maybe I would give you a clear view of exactly what it was like. But I will come back in on day 4, which is tomorrow. Like, I look a heck of a lot better than I did yesterday. And my eyes aren't as scratchy. So I took my contacts out. I don't have any contacts in. I've just been putting eye drops in, just your homeopathic eye drops. I stopped taking pain meds. I'm not taking any sort of pain meds. I am on penicillin. So, you know, of course, an antibiotic, you have to take, an antibiotic with that. And I also took, to relieve, like, and it really didn't stop a lot of it, but maybe it did. Maybe I'd even be worse. But I took Arnica montana bromelain, which is like it's and a pineapple. I've been eating a lot of pineapple, papaya. They say all of that will help. I stopped all sort of my supplements. I didn't do my Shakeology because it has omegas in it, and omegas make you bleed. I didn't do any Tylenol, yada, yada, yada. I do some vitamin K right now. They said, too, that would help the swelling. So, yeah, I'm swollen quite a bit. You could see in my like the bridge of my nose. And I took off I took off on Wednesday, so it's quiet. Sorry. Wednesday, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. So the first time that I will have to go out and actually teach a class will be the 11th day. But in a week from Monday, I will be going back to work. But I can also wear, if it's any of this, I know I've kind of like camouflaged some of this with a little bit of makeup. This is almost impossible to camouflage right now. I'm hoping that this goes down within the next couple days, and then it reduces its color. But like I said, I'm not in pain. I'm already liking it because, you know, she took away all the loose skin, you know, when you have the loose skin and then you try to put up, I don't wear eyeshadow, but even when you're trying to put on like an eyeliner, your skin just kind of like floats with you. It's just all flabby. So that will all be taken care of along with my horrible fat pads. And I'm sure everybody knows all about fat pads if you have fat pads. If you don't have fat pads, you won't know what I'm talking about. I'm also a little bit more on the thin side. So I'm a little girl. I teach a lot of classes. I do turbo kickboxing and Pi-Yo and strength training. So I'm pretty thin. So when the more thin you are, like the less fat you have on your body, the more you're going to see your wrinkles and your fat pads and all of that. Of course, if you're a person that is 50 pounds overweight, you're probably not going to see these fat pads because you've got fat surrounding all the rest of the area. Well, I don't have any of that fat surrounding the rest of the area, as you will see. So as I progress, I will give you some more data. So I hope this was helpful. Again, this is Day 3. I had it surgery Wednesday at 9 o'clock in the morning, and it is Saturday at about, let me see, what time is it exactly? 12:48. So basically Wednesday, Thursday, Friday. This is day 3 after surgery. So I think it's pretty good. I'd go out with sunglasses on, you know, which is not a problem. Anyway, if you need to message me or ask me any questions of any sort, I will be more than happy to let you know anything that you need to know. And if you're fearful of this, don't be. Like I said, the first couple days might be horrible, but you won't remember them. And it's so worth it because you're going to love the results of what's going to happen to your eyes. So anyway, for everybody that's fit out there and you know that you're fit and you're trying to do everything you can, well, there's some things that you can't do for your face. You need some assistance from a really great, you know, reconstructive surgeon, plastic surgeon, facial reconstructive surgeon, whatever that might be. So make sure that you get the good doctor that you need. In Chicago, I say Stacy McLean. Okay, see you tomorrow.